Good morning, everyone, and I hope you and your families are doing well and staying in good health. I want to thank all the media that is here. I deeply appreciate everything that you are doing to make sure that we get the word out to our Springfield residents and business community, so thank you very, very much. I'd also like to thank all the first responders, from police to fire to DPW workers, health workers, my behind-the-scene people in the back offices. I'd also like to thank the grocery workers. I want to thank the PVTA bus drivers. I'd like to thank the stores that are open, the mail handlers. I go on and on. You're all our heroes. You're all our heroes. Because what you're doing is very, very essential, and I wish you good health. I'd also, we've lost people to this hideous COVID-19 coronavirus, and we are now, our knowledge through my Commissioner of Health and Human Services, we haven't received an update, but I believe 11 Springfield residents have passed away, and obviously our dear veterans and the Holyoke Soldiers Home, some who are Springfield residents. And also today is a somber day for me. Today marks the second anniversary of my beloved mother, Clara Sarno's passing. So with that, I'd just like to have a moment of silence for those who've lost their lives, to their families, and those that are dealing with the situation now. And to my mom, and Mom, I know if you were around, you'd be making masks left and right for everybody. Ace seamstress tailor that she was. Thank you very much. I just got off the phone. We just finished my cabinet heads meeting, and during the meeting, Lieutenant Governor Karen Polito called in to touch base with me. I've been in contact with the Lieutenant Governor and the Governor over the weekend. You know, the old adage, try again. And I'd asked my Chief of Staff, Tom Ash, through my Emergency Preparedness Director, Bob Hassett, to once again put into MEMA another request for thermal infrared thermometers, testing kits, and Abbott machines. Well, I'm happy to say the second time around that the thermal infrared thermometers have come in, and we got them today. So I'm very, very thankful to Governor Baker and to Lieutenant Governor Polito for their continued efforts. I also want to thank them on behalf of my fire and police departments for the KN95 masks. I can tell you the story now, as I was a little bit diplomatically aggressive and emotional a week or 10 days ago in order to get the supplies that were needed for my brave and dedicated police officers and firefighters and frontline providers. That the governor and I spoke a few times, as did with the lieutenant governor. And at the time, their strategy with the surge that we're under was that they wanted to save as many, especially N95 masks, for the frontline hospital personnel who are doing yeoman work, from doctors to nurses, all the way down to custodians, CNAs, you name it. They're day in and day out. And we spoke that evening also. And the governor, a man of his word, have a great relationship with him. And the lieutenant governor said, as soon as I can clear that we have enough supply for our hospitals, our medical facilities, I'll get you those masks ASAP. And in turn, he's been able to, as I said, for the whole Commonwealth, been able to get the KN95 masks to fire departments and to police departments throughout the Commonwealth. So I want to thank Governor Baker and thank Lieutenant Governor Polito and Health Human Service Secretary Mary Lou Sutters and Samantha Phillips from MEMA. I appreciate that. I take the time to diplomatically torture. I will also take the time to say thank you, thank you, thank you. I'd also want to give a shout out, again, both the President and CEO of Baystate Health Systems, Dr. Mark Kerouac is here, and the Chief Medical Officer from Trinity Mercy Hospital, Dr. Robert Roos is here. But I want to give a shout out to Mark, your Dr. Arnstein, who's Arnstein, I'm sorry. His military training came in very, very well in his clandestine efforts to make sure that Baystate received all the supplies they needed. As we've heard, on the federal level, a lot of things were getting confiscated and taken by FEMA. So I want to give him a big shout out on that, how he was able to do that. The count as of late yesterday who have tested for the virus here in the city of Springfield is 797, 38. We're well over 100 over the weekend. My Commissioner of Health and Human Services, Helen Carlton Harris, like with all my cabinet heads and rank and file, she's really done tremendous yeoman work. Notifies me that DPH, the governor, has ordered through Secretary Mary Lou Sutters to really take a much more active approach with the National Guard, the med techs, which we have some in our homeless triage facility, with long-term care and senior complexes. In turn, they have visited Mason Wright and Loomis Reed's landing this past week. On our homeless count, we're up to 15. We are now down to 7, and I appreciate the very nice front page article, a Sunday Republican yesterday, on Karen Jeffers and homeless providers appreciating the moves we've made to make sure that vulnerable population is taken care of. I believe Helen will speak to you that we're going to start testing the homeless, I believe is Wednesday. That's important. As what Mayor Walsh in Boston found out in Worcester, when they started testing, I see Dr. Roos nodding his head, when they started testing their homeless populations, their numbers escalated immensely. So we want to be able to test. And I'm going to speak about testing overall, too, on that. I want to, in the meantime, when I was unable to get supplies that were much needed for the city of Springfield, whether through the feds or through MEMA, the business and private sector stepped up big time. And I just want to take the time to thank them. And let me just quickly, because they deserve thanks. Smith & Wesson, Eastman Chemical, the Crew, which is headed by my retired clerk, Attorney Wayman Lee and Jesse Spinks. Dave Horrigan, media instructor at the Conservatory of the Arts. These are masks and gloves and the glasses that came in and facial masks. CRRC, huge donation made with KN95 masks. AMR, they were the first ones, Patrick Leonardo, to step up to the plate when on my desperate plea for thermal infrared thermometers. Nick Kochi, a great friend and great partner, Hampden County Sheriff's Department, masks and face shields. Tyflex masks. Tim Murphy from the Newton School, from the Chinese family that saw we were going through, masks. Merrill Lynch, masks. Holyoke Medical Center, Spiros Zadaris, who's a great friend, stepped right up with the surgical masks and gloves. Mass Mutual, great corporate citizen, stepped up. MGM, Springfield stepped up. Cheryl, Commissioner Clapper, the Boston and Chelsea PD Police Chiefs Association stepped up. Caring Health Center stepped up big for me, big time. Ocean State Job Lot stepped up. surgical masks. Aaron's Inc., the appliance or technology store, they stepped up for me also. And little things mean a lot. Elena Laster, who she and I worked together in Billy Bennett, DA Billy Bennett's office, some 20 years ago now, and these handmade masks. She's an author, Betty Laws, and little things like that. I know a lot of people are doing that, and we want to make sure we thank all the restaurants. I know I'm going to miss some, so I won't get into them, who have donated a tremendous amount of food to all our first responders, and I deeply appreciate that. Prime the Pump, Chief Development Officer Tim Sheen will speak on that, but checks were the first to come out of the box, and I believe all of Western Mass, maybe even in the state. Checks went out Friday. Already checks have gone out on the first round. Every restaurant that received the first round grant contracts have been signed. The second round of Prime the Pump for small businesses, that is being evaluated right now, and we're hopeful to render some decisions, again, on the criteria, HUD and CDBG criteria, as early as midweek, and we'll try to pump those checks out ASAP. Tim and I will continue to do as much as we can on the local level, but we really need the feds to step in big time to make sure that they're able to increase, besides the PPP, other SBA loans and or grants. Ours are grants, loans, and do it in a more smooth way. Police Commissioner Clapprood will speak on the police department. We had unbelievable shootings that occurred on College, Maynard, and Page Boulevard. Drug and gang related. Arrests have been made. Guns have been confiscated. Large amounts of money have been confiscated. No one is cooperating. This was people congregating together. Do not be surprised that some of the individuals that we have are once again repeat violent offenders that our courts have let go. We're going through that now with some judges and DAs allowing offenders to go with this COVID-19. And I get it, within reason, but there are some of those offenders that are being released are violent offenders, repeat violent offenders. And I'm going to give credit where credit's due to Suffolk DA Rachel Rollins, who is very liberal in her thought process, but even she was bent out of shape with a murderer being released out in the Suffolk County, Boston area. And again, I want to thank DA Anthony Collooney and Sheriff Nick Kochi for continuing to take a tough stance where compassion is not needed. So, again, I'll let that go for right now. We'll get back into that after. On the testing front, target testing, I just spoke again. Lieutenant Governor Polito called me a little while ago. Like everybody, I'd like to be able to open up yesterday. But we have one shot to do this thing right. And this really has to be driven from the federal level, trickling down to the states, and then in turn, as Governor Baker is working with surrounding governors in the area, I will work with, or we need to get together regionally with cities and towns that we're on the same page. But we have requested again that we want to do some target testing. We're already doing contact tracing. Governor Baker has taken a lead really in the country in doing that. We've really taken a lead here in the city of Mass as far as we're already doing on our own contact tracing with the school nurses, Superintendent Warwick, I appreciate that, and my health team, in which we started doing contact tracing a while ago. But my point here is that if you want to be able to open up and have full confidence of the public, of the business community, hospital confidences, consumer confidences. We have to be able to show that we can isolate potential hotspot areas or individuals, that we're able to identify and isolate, mitigate, contact trace. If we're able to do that, and just as important, provide healing to those potential hotspot areas and individuals, then you will have confidence that is long-lived. If you move too quickly, that confidence will be short-lived. So we want to do more testing to identify, isolate, mitigate, contact tracing. So again, I said that to the Lieutenant Governor. We'd have to work in coordination, but whatever testing we can do, whether it's with the Abbott machines, testing kits, is essential to be done. Then people are going to really feel confident. So if and when a hotspot area flares up, they have full confidence knowing that we can deal with it, whether it's the nation, the state, or the city of Springfield. So I think that's extremely important. I also want to thank the help that's coming from my state delegation. We're meeting every Friday at 1, Zoom meetings for our needs, and of course my federal conduit, Chairman Richie Neal, Congressman Neal has been great every Tuesday morning with the cabinet heads, the help that comes there. Police is down 10, but she'll talk about all the Commissioner Clapper will talk about all the proactive measures we have done to keep those numbers down. So will Fire Commissioner B.J. Calvey, who's down 4. Superintendent Warwick will be speaking. We're in essence nearing, I think, over 300,000 meals out of 17 or 18 school sites served, not only to our students and families, but all the children of the area. And the superintendent informs me that maybe sometime this week some direction might be coming from the state or DESE or Commissioner Riley on school decisions to be rendered of whether going forward or not. The laptops have gone fantastic. We had 7,000 out prior during the school year. 10,000 have gone out even to our homeless students, so we appreciate that. Pat Sullivan's on it. He'll speak. He's done a great job with the tents and our parks. On our financial side, my CAFO TJ plan indicates to me that we've lost revenue, $2.3 million in revenue, and we have spent $1.3 million. And again, with Josh Norman of GPS Associates, as we did Tornado, I'm going to try to go after every dime of reimbursement for the residents and business community of the city of Springfield. On the DPW front, Director Signoli speak to you. They're down 2. They're hoped to be full strength as early as tomorrow. They're a little behind in the yard waste, so they're catching up on that. I want to thank DPW Director Chris Signoli and Police Commissioner Cheryl Clapper, the food bank Oasis that John Foley does, tremendous. We're running that out of Central High School parking lot, Smead Arena, and then in a very orderly way there. 1,700 families were served. We're served Fridays, and we do that Friday from mid-morning to early afternoon for food security. I just have to make note, people get very cute. Putting Green Circle. The residents of that area have been inundated with golfers who are parking on that street to go play golf on Franconia. Don't get me going again. So in turn, you're going to see enforcement occurring on Putting Green Circle, and you're going to also see signage going up there. So please adhere to the public distancing that has been asked to do, and also be respectful of those residents in Putting Green Circle. They don't deserve that. They don't deserve that. So I'm asking you nicely, but if you don't do it, you're going to face ticketing, towing, and signage going up there. So hear me loud and clear. With that, I'm going to now move to our medical part of the presentation. And again, I am so thankful and grateful to Dr. Mark Kerouac, the President and CEO of Baystate Health, and Dr. Robert Ruse, the Chief Medical Officer of Trinity Health, Mercy Hospital, for taking the time to be here. And I appreciate all the efforts that they're doing, and we're working collaboratively together to deal with this surge, and probably more importantly, to deal with, at the right time, phasing out and getting back to some sense of normalcy. So with that, I will call up Dr. Mark Kerouac, the President and CEO of Baystate Health Systems. Thank you very much.
Well, good morning, everybody. Mr. Mayor, thank you for holding this event today. I very much appreciate your leadership and the leadership of your whole team that you've all shown during this epidemic. Also very grateful for the support we've gotten from our legislative delegation and for Congressman Neal, and for all of you here in the media who've, I thought, have provided excellent coverage throughout this. Let me quickly run through the numbers. As of yesterday morning, you know these will be updated at noon. We had 794 test positive at Baystate Health, 2,820 test negative. In-hospital numbers, it's been an interesting story. These have been flat and stable for quite a long time. As of yesterday, we had 141 positives, only 19 in critical care. And I brought a visual to show you all today. This is the look of the epidemic curve at Baystate for the last several weeks. You can see in the blue, this is everybody who's in the hospital on any given day. It peaked down around the 8th of April at about 180. The last several days, it's been at about 140. The red shows the people who are on a ventilator in critical care. That peaked right around the 2nd or 3rd of April at around 40, and has come down now to under 20. So certainly things are stable, and possibly they may even be going down. This is a trend that has been seen across the hospitals of Western Mass. We were on a call last Friday with all of the CEOs of the Western Mass hospitals who are reporting the same thing: flat cases, maybe going down a little bit. Part of this has to do with the fact that we're getting better at managing these patients. We are less prompt, or we're delaying the onset of ventilators, which allow patients to breathe on their own and go home from the hospital sooner. And we're achieving very good survival rates as a community of hospitals. At Baystate, when you leave out the patients who are in the hospital today and simply look at those who have been discharged or who died, there is an over 70% rate of discharge, successful discharge. And when you exclude the people who had advanced directives, that is to say very elderly individuals who did not want to be intubated under any circumstances, the discharge rate is over 90%. So the success rate has been good. And so we're comfortable with the current levels of cases, and currently are less than 50% of our planned surge capacity. This is the reason that we did not ask the state to build a field hospital at the Mass Mutual Center, as they've done in other parts of the state, because we felt we had capacity within the four walls of all of our hospitals as a Western Mass community. What this does not mean is that we are through the woods. The virus is still spreading, in the communities. How fast it spreads and how far really depends on how successful we are in continuing to practice the preventive measures that you've heard us say each and every week. Social distancing, covering your mouth and nose with a tissue or your sleeve when you're coughing or sneezing. Don't go to work when you're sick. Wear a mask in public and wash your hands. I mean, those recommendations have been the same since the first time we stood up here. I think you heard me say a few weeks ago that we didn't want to be like Italy here in Western Massachusetts. There are a number of wonderful things about Italy, Mr. Mayor, but COVID-19 was not one of them. In Italy, things happened so suddenly and so unexpectedly that the cases shot up and it overwhelmed their health system, and it was really horrible. And it's pretty clear, based on the curve I showed you, that we have not been Italy, and it's thanks to the efforts of everybody in the community to practice all of these preventive measures. Today, I want to tell you that we don't want to be like Singapore. Now, let me tell you the story of Singapore. Singapore is a tiny little country of 5 million people, far more dense even than New York City. And they're a very authoritarian state. And so in early March, when cases started appearing, they really clamped down on social activity and were able to hold cases to about 300 in a country of 5 million. Pretty amazing. However, they then decided, well, this has passed us by, and now it's okay for us to go ahead and do things like we used to. And they overlooked the hot spots. And for them, the hot spots were very crowded dormitories where poor migrant workers were working in Singapore. And because they ignored the hot spots, their case rates rocketed up to 6,000. That's really kind of the MO right now for us here in Western Mass. It's trying to get outside the four walls of the hospital. We believe we have the hospital situation under control, and now we need to focus on the hot spots. For us in Massachusetts, this has been nursing homes. Roughly half the deaths have come in folks who are in nursing homes. But I think it's also some of the communities in inner city Springfield where it's harder to do social distancing, either because people have to go to work, they don't have paid sick time, or because they are housing insecure. In addition to which, there is more in the way of a chronic disease burden, which increases the risk of death if they catch COVID-19. These are often communities of color. These are communities that Baystate has been traditionally caring for generations, and which we are fortunately now partnering more than ever with community social agencies through our Medicaid ACO, as well as partnering with Caring Health. So I'll say more about that a little bit. A lot of the conversation this past week has been the planning for after the pandemic, and we have started our planning. The big question is, how do we safely return to greater activity? I'm not going to call it normal, because it's going to be a long time, if ever, that we see normal as we knew it to be 6 months ago. The federal guidelines were issued just last week, and they gave, I thought, a very reasonable, deliberate, stepwise approach to opening up and checking each step to make sure that cases weren't expanding. And we understand that the governor, in collaboration with the other 6 governors in the Northeast, is going to have the final say about how we open up the state of Massachusetts. But at least based on what we're seeing here in terms of case load, we feel that we will soon be ready to take that first step. And we've been communicating the situation here in Western Mass to the folks on Beacon Hill to let them know that things are settling down here a little sooner than they are in the eastern part of the state. I also wanted to say a word or two about, in addition to the 140 or so people who are being cared for with COVID-19 at Baystate today, there are 350 people at Baystate Medical Center who are being cared for something else. They're moms having babies, they're people having cancer surgery, they're people being cared for strokes and heart attacks. These diseases are not taking a vacation just because COVID-19 is here. I am getting concerned that I'm hearing stories from our providers that people are waiting too long to come for care. I've heard 2 or 3 stories of little kids with belly pain who came in with perforated appendices, who probably would have come in sooner if their moms weren't so afraid of the possibility of going outside their houses and catching COVID-19. Similarly, I'm hearing from our cardiologists that many of the folks with heart attacks they're seeing are much more advanced than they otherwise were just a few months ago. So I think that everybody needs to understand that all of the hospitals in Western Mass have taken great pains to keep people safe regardless of what you've got. We have segregated our patients with COVID-19, and we have made it safe for people to come with other diseases, and it is unsafe for you to sit home and try to wait it out if you've got something serious. And so please don't do that. On the PPE side, the mayor alluded to some of the stories of the extraordinary lengths we've gone to get PPE for our caregivers. The mask supply seems to be secure at this point. Gowns are the order of the week, and we're doing all kinds of creative things to try to get gowns in place. We're very grateful for the donations we've gotten from folks in the trades, as well as some of the local manufacturers who've retooled their shops to start making this stuff. Fortunately, we also are not seeing transmission to healthcare workers who are caring for COVID patients because of not only the PPE that we're providing, but also the training and coaching about how to put it on, take it off, and we're knocking on wood that we're not seeing the kinds of transmission that's been seen in some other facilities where people don't have what they need or are caught unawares. As far as the testing goes, because we are expanding testing this week. We are currently testing in Springfield, Westfield, Greenfield, and Ware, and are now accepting for testing any symptomatic community patient with an appointment or a referral from a doctor, which means if you think you need to be tested, you ought to be talking to your physician first. We're looking to open other sites as part of our outreach to the vulnerable populations I mentioned before, and I'm hoping next week to have an announcement about that. The increasing availability of testing, of course, means we're going to see more positive patients. But to me, that doesn't necessarily mean we're seeing a growth in the number of real cases. What we're learning from a new kind of testing called serologic testing is that the number of cases we know about is a small fraction of the total number that are out there. There was a study done by the folks from Stanford out in Santa Clara, California, Santa Clara County, where they estimated that if you looked by blood test for antibodies to people who have ever been infected by this virus, you found 50 to 80 times more cases than by simply the nasal swab, which tells you if you've got the virus at the current moment. So part of understanding and getting our arms around that stuff is making available this additional, this different kind of testing, which basically tests whether or not you've ever seen the virus rather than whether you have it at the current moment. I believe that we're going to be seeing COVID-19 patients at some level for the foreseeable future in the hospitals in Western Mass, and we're going to have to learn how to sort of gradually get back to more and more normal activities while maintaining some level of safety. And that balancing act is going to be the work of the next few weeks. We are looking forward to working with our community advisory councils, our accountable care organization leaders, the Public Health Institute of Western Massachusetts, Commissioner Carlton Harris, and others to try to identify and control these hot spots. We've already reached out to 24 medical directors of skilled nursing facilities to make sure they know what to do and have got the right equipment. We're using telehealth more than ever to improve access to people who are ill. And we're supporting a number of providers across the valley, not only the skilled nursing facilities, but the Holyoke Soldiers Home, the residential facility for recovering first responders out at the Ludlow facility, as well as the homeless shelter. Lastly, I'll just note that there's been a bit of a social movement to give heartfelt thanks to our healthcare workers who are working under stressful circumstances. I spoke just last Friday to a nurse whose dad is in a hospital in Connecticut recovering from COVID, and she's working on one of our COVID units. She can't visit him because of the visitor policy and is really toughing it out in spite of tremendous stress in her own personal life. And she's just one story of the many that we could tell. We do, though, really appreciate the support that the community has shown, and I think we've all tried to express our appreciation for the amazing work that they're doing. They really are feeling the love. So with that, I'll end, Mr. Mayor, and I thank you again for the opportunity.
Thank you, Dr. Caraway. I also want to thank the lovely young ladies that are here, my sign language individuals. Thank you for being here. We appreciate that. Let's give them a round of applause. That one I can do. How's that? Okay. With that, another friend and medical professional like Dr. Kerouac and his team going above and beyond is Dr. Robert Roos, who is the Chief Medical Officer for Mercy Hospital, Trinity Healthcare. Dr. Robert Roos.
So good morning, everyone, and thank you, Mayor, and to all the commissioners. Another dose of gratitude for your strong leadership amidst these trying times. And the model of transparent and regular communication is really one that is essential during this type of pandemic. This morning, I'm pleased to report and would like to convey to the community that the overall sentiment at Mercy Medical Center this week is one of stability, hope, and promise. Informed by science, as well as our data of cases in our hospital and the countless stories of recovery, we have a hope for the continued deceleration of this pandemic and a promise to you that we remain prepared and ready to care for all of your important healthcare needs. This week actually marks 3 months since the diagnosis of the first confirmed case of COVID in the United States on January 22nd. It wasn't actually until the beginning of March when that number crossed 100, about 6 weeks ago. And then we all remember now very well the story over the course of the last 6 weeks, where in 1 week it went to 10,000, in another week it went to 20,000, and in the last month, the number of confirmed cases in this country now exceeds 760,000. The rate at which this pandemic has spread has been unprecedented and extremely rapid. And quite tragically, along with that community spread has come a tremendous amount of uncertainty and loss, including the death of tens of thousands of individuals, something that should never be minimized. I also do not believe that we are completely out of the woods yet. There are new infections every day, and we are all keenly aware that we are always just a few cluster of infections away from moving in the opposite direction without the appropriate mitigation strategies. Yet just as fast as the infection spread, hospitals prepared to meet the needs of our patients and communities came together to help flatten the curve, like here in the local greater Springfield area. The social mitigation policies that were implemented at the state and local level have now started to show their effectiveness, and the evidence from our own data at Mercy, which echoes that of Baystate and the other hospitals in our region, is that in terms of our test results, our hospitalizations, and our ICU admissions, we are seeing a slowing of that transmission and a blunting of the overall impact. As of today, Mercy Medical Center and affiliates has performed 3,257 tests with 1,076 positive results, 2,122 negative, and have 57 pending. But we too peaked in the first week of April, between April 2nd and April 6th. And over the last 10 to 14 days, despite testing more patients than we ever had before in a given week, the numbers of patients in the hospital under investigation or with confirmed COVID has slowly but steadily decreased, not increased. And as of this morning, we are operating at only about 40% of our total maximum bed surge capacity. This is important, as collectively as hospitals, we have prepared well, and we remain ready for any potential surge of patients now or in the future. We have plenty of inpatient beds. And as of the result of the incredible partnership of many teams in just 4 weeks, our hospitals have really become expert in managing patients with respiratory symptoms and COVID. At Mercy Medical Center, we've treated more than 300 patients now, with confirmed COVID infection, of which the vast majority have been discharged home to recover. This is a result of the great care provided and some innovative strategies. And part of our efforts to care for these patients has been, as we've discussed before, creating special dedicated units with specific care teams that are separate from our other areas. In the emergency department, it has included developing processes at the front door to screen patients, to provide evaluation and triage and treatment in areas separate from other patients. In our ambulatory practices, we've created fever and upper respiratory infection clinics to keep the sick patients away from the well patients, those that need preventive care. And we are utilizing evidence-informed clinical protocols and engaging in research throughout our system to ensure that our patients are receiving the latest and most effective options available to them. All of those efforts have undoubtedly led to the countless stories of recovery. What it also means is that we've mastered, to an extent, the ability to care for both COVID patients and non-COVID patients in parallel in our facilities, so that you and your loved ones do not have to be afraid of coming to the hospital or our offices for care. You do not have to delay important evaluations or provider visits if you are in need of follow-up, and you do not have to avoid coming to the ER if you get suddenly ill. As a physician, that is actually one of my biggest concerns right now. I too am concerned that there may be people at home with serious conditions who need follow-up, who are avoiding coming to the care due to fears of COVID. And today, I want to allay or put those fears to rest. At Mercy, just like all the hospitals in Western Massachusetts and around the region, we continue to treat patients with a variety of conditions, from abdominal pain to stroke, to sports injuries and fractures, to chest pain and cancer. We continue to have patients come to us for prenatal care and deliver babies, as well as routine care. 7 days a week, all of that care is still happening, safely and effectively. At our hospitals, we've created dedicated units to care for patients that do not have symptoms of COVID-19, that are separate with different teams of providers and standard protocols. And right now, more than 2/3 of the patients in our hospital are receiving care in those areas without risk of COVID. We have adequate supplies of PPE, thanks to great sourcing and many donations, so that all of our staff have the recommended gear that they need to put themselves and our patients, to keep themselves and our patients safe. We've created ways to have visits with your physician or provider through the use of telemedicine, video chats, like a secure FaceTime, from the comfort of your own home, or if you're in the hospital and you can't see your families, to be able to communicate with them from the hospital bed. We are testing any individuals and colleagues with risk or with symptoms of COVID to ensure that we identify positive cases quickly and we respond accordingly. And we believe firmly that we must continue our community mitigation strategies, closely tracking new infections. And we're here to help ensure that we have the available testing for those populations at risk, particularly those in congregate settings, the homeless, the marginalized, those in skilled nursing facilities. It's essential in order to continue to guide our efforts. So while it is not time at all to relent in the efforts that are flattening the curve here locally, like physical distancing, hand hygiene, wearing masks in public, it is important to know that we are ready and prepared to care for all of your important health needs, whether it's related to COVID-19, whether it pertains to a future surge of COVID, or just as equally important, any other conditions during this time. It would be a tragic outcome if our public health response to this pandemic resulted in our community suffering unintended and avoidable health effects, like increasing rates of heart attack or stroke, or worsening kidney disease as a result of poor control of diabetes, or worse neonatal outcomes due to insufficient prenatal care, or outbreaks of illnesses due to lack of immunizations. We have all been forever changed by this pandemic, and it will be a very long time, if ever, we truly enter a post-COVID world. I do not believe now is the time to relax our efforts, but I do believe now is the time to be prepared for what will be a prolonged, slow COVID period, where we come together to thoughtfully and carefully take steps forward to ensure that our community can remain healthy and safe for the weeks and months and years ahead. We are grateful for all of your support. Thank you for being in this with us together.
Thank you, Dr. Roos. Thank you, Dr. Roos, very much. And tell Sister Caritas we appreciate those prayers very much. So. My cabinet heads down the rank and file, tested and true. We've been through, again, as you know, a number of natural man-made disasters, and by all accord from all around, tremendous job moving us forward. This is a little bit of a different animal that we're dealing with here. The other ones, you know what hit us, and we knew how to hit back. Leading the charge, and my point person, has been Commissioner of Health and Human Services, Helen Carlton Harris, well respected, who has really done yeoman work. She will now come up to give an update and some strategic moves that we'd like to look to make as soon as possible. Commissioner of Health and Human Services for the City of Springfield, Helen Carlton Harris.
Thank you, Mayor. First of all, I want to begin by thanking the mayor once again for his leadership. It has been invaluable. I also want to acknowledge the passing of a public health advocate in the city of Springfield. She was our 2000 Luminary Award winner. Her name, Frances Borden Hubbard. Mrs. Hubbard died of COVID-19 in Brooklyn, New York this past week. My condolences to her family and the entire public health community. Hearts go out. She made a difference in the city of Springfield, particularly amongst our youth. The update for the city of Springfield, let me first of all say that you've heard from the two doctors at Baystate Health at Mercy Medical Center and Trinity. So their report is very encouraging, that the curve has flattened in their hospitals. But let me speak to the public health response. All of us understand that medical services and public health do go hand in hand. Each one has a role and responsibility. Our responsibility in public health is population-based. It's our job to look across the population and design intervention, prevention, and treatment strategies consistent with those populations, using the data that we know is very important in order to make those decisions. And so in the city of Springfield, I reported to you 541 COVID-positive cases 1 week ago. Today, that number is 797 as of Sunday. And so it's important to acknowledge that the modeling we had for the Commonwealth of Massachusetts said that we were going to have over 2,000 deaths before we started to see the flattening of the curve. Right now, we stand at 1,706. And so we are on our way to reaching that 2,000 death total unless we continue to do the very important things that we are doing. First of all, I want to draw your attention to the map, which is to my right. Now, many of you have contacted me and said, I want a copy of the map. The purpose of the map is to measure the prevalence of the virus in the city of Springfield, meaning how pervasive is the virus in our community. We in public health try so hard to balance the public's right to know along with confidentiality. I have heard from many individuals who have taken pictures of the map and tried to overlay streets onto the map. The streets aren't there because we are not reporting streets. We are showing this map just to show you the incidences of COVID-19 in the city and where it is impacting the most. I talked to you about the zip codes disproportionately represented. They continue to be 01103, 01105, 01107, 01108, and 01109. What is unique about those areas is that there are high-density areas, people living close together, geographic density is reality, it is common, and so density, people living together, people who may not have the ability to social distance based on the fact that they are in multi-generational households, and in those households they are living close together in small units. Individuals, you've heard, with traditionally underlying conditions such as heart disease, cardiovascular disease, diabetes, asthma, high blood pressure. All of those things are underlying conditions, and we know they are more prevalent in communities of color in the city of Springfield. And so absolutely, we're seeing in those neighborhoods increased spread of COVID. Also, social determinants of health. Social determinants of health are the aspects of the environment where an individual is born, grow up, live, work, as well as the systems that are in place to deal with illness. We've talked about nursing homes. We know that over half of the deaths in the Commonwealth of Massachusetts are from nursing home or long-term care facilities, 884. That situation is being monitored by local public health, our hospitals, as well as the med techs of the National Guard. They are going around to highly hit areas and nursing facilities and doing testing. That is really very important, that we keep those partnerships and those relationships. We are very proud of our first responders, our medical facilities, those individuals who are doing work that is just unimaginable in terms of putting themselves at risk. I also want to acknowledge the certified nurse assistants who are so often charged with cleaning the rooms, taking care of individuals, our community health workers who are really doing a great job going in our communities and doing outreach. It is important that we understand that some individuals do not have the option of staying home. They must go out and work to feed their families. Grocery store workers, bus drivers. There are many individuals who are in our community who do not have the option to stay home. Homeless testing. We will begin that on Wednesday. It will start with the women's facility, the 35 to 40 individuals there, to the men's residence next, and then to the larger facility. We understand in order to retain the confidence that we need to reopen in the city of Springfield, testing is important. We are so fortunate here to have within our footprint and in those communities where you see the prevalence of red dots, health centers. Brightwood Riverview Health Center, Mason Square Health Center, High Street Health Center, Caring Health Center, and I must mention Holyoke Health Center. Our population is very transient. They move back and forth. And so it's important that we're pushing out beyond our borders and making sure that we're having those conversations with those cities around us. We need more testing. How many times do we have to say that? We say it often, we say it really so many times, but it's critical that we are being able to test. We can start in those zip codes that you see the majority of the red dots, so we can begin to really understand the prevalence. Trace, contact tracing. I have heard from many of you who have called me to say, you have gotten telephone calls from individuals doing tracing, and you tell me you don't want to give those folks your information. You don't want to tell them who you have been in contact with. Many individuals look at this as almost like an STI or a sexually transmitted infection. It's not. This virus is nobody's fault. And when we ask you for the names of the individuals that you have been in contact with, it's because we want to stop the spread. We are not trying to get in your business, as folks have told me. We are not trying to pinpoint you as a source of anything that's negative. We need the information so that we can follow up and keep everyone healthy and safe. Please, when you get that call around contact tracing, please give the information that is asked of you. It's very important to our public health, population-based response. The hospitals have done an excellent job in flattening the curve and doing treatment and making sure individuals are being discharged and that they are being discharged to home and are healthy in terms of their ability to survive and thrive. We appreciate that because treatment is important. Vaccination. It's important that we are able to vaccinate. There's not one available yet, but there are people working around the world to try and get a vaccination so that we are all comfortable. So the strategy for being comfortable is test, trace, treat, vaccinate. And finally, as I take my seat, I would say that the first African-American woman who won a Pulitzer Prize for poetry, her name was Gwendolyn Brooks. Gwendolyn Brooks said, "We are each other's harvest. We are each other's magnitude and bond. You and I are the leaders, the healers, and the teachers that we have been waiting for." The federal government has a role in combating this virus. State government has a role in this virus and response. Local government has a role in response. And each of us must take personal responsibility because we have a role in this response as well. I want to say what everyone who stands at this podium will say. Please, social distancing, please, please, please. Wash your hands frequently. Stay home if you're sick. Wear a face covering if you are out in public. Stay home, stay safe, stay strong. I also want to say some thank yous. Jason Mann is the wonderful young person who works for economic development, who helps me with this map. He is just amazing. I also have other data points that he gives me that I will be sharing from time to time. Thank you, Springfield Department of Health and Human Services, for always being there and being willing to step up. Thank you to AMR, who is doing the 11 to 7 shift down at the shelter. Appreciate you so much. Springfield Public School nurses, I can't say enough. You jumped in, you did the contact tracing. We are moving forward. Thank you very much to those individuals who are on the front line with us, who communicate every day. But let me thank the residents of the city of Springfield. When I go around and I see individuals with their masks on, or I see social distancing, I think to myself, this is how we're going to win this. Remember, we are each other's harvest. We are each other's magnitude and bond, and we will get through this together. I thank you, and remember, public health, population-based, take care of each other. Thank you.
Thank you, Helen. Great job. Now you know why I call her the elegant Commissioner of Health and Human Services, Helen Carlton Harris. Great work, Helen. We'll now get a school update from our homegrown superintendent, Superintendent Dan Warwick.
Thanks, Mayor. Good morning, everyone. We've continued with our feeding program, and as of Friday, we distributed over 260,000 meals from 17 different sites. We're now doing breakfast, lunch, dinner, and snacks at 17 different sites. And we've opened it up beyond the Springfield borders, both public, private school, but also the surrounding communities for folks to partake in that. We have distributed over 17,000 computers so far, and for any family that didn't engage in that process with our first distribution, we're going to reach out and say, just contact your local school and we'll either deliver a computer to you or allow you to pick up a laptop at your local school. Right now we have, the commissioner has canceled MCAS for the remainder of this year, and we're waiting to see how he deals with the competency determination for our high school students looking to graduate. And right now we have a return date of May 4th. We're expecting within the next week to get further word on when students can come back to school. That's all I have, Mayor. Thanks.
Thank you, Superintendent Warwick. Thank you, Dan, Superintendent Warwick, for you and your team's continued dedicated efforts into teachers who continue to virtual education to make sure our students continue to learn. We'll go to the public safety segment now, and I'll start first with our police commissioner, Cheryl Clapprood, who has done a tremendous job, and our brave and dedicated men and women in blue, and a lot of preventive work that has been done. And she's going to share where we're at and where we're going. Springfield Police Commissioner Cheryl Clapprood.
Thank you, Mayor.
Thank you,
The police department, as of today, we are down 10 officers because of COVID illness or COVID-related illness. I have 11 officers who at one point tested positive and are now back to duty. I only have one awaiting a status test. So we're down 10 today. It's obvious that with 16 positives at one point or another, the virus was amongst the ranks. And I believe that we've kept it as low as it is, and we're able to sustain the manpower because of some of the initiatives we took right away, which would include going to a one-man or one-person car, separating and using 5 different locations to work out of, the cleaning procedures that we've been doing with cruisers before the shift and after the shift and during every transport, and the use of the PPE. And thank you to the mayor and those who donated and fought for us. I was now able to make sure every officer has plenty of the N95 or KN95 masks. We have the gloves, we have the goggles and the glasses. We have changed the way we respond to medical calls. I've worked with Commissioner Calvi on that. So because of those things that we have done, I believe we limited the spread of the virus throughout the ranks, so we're in pretty good shape. The National Guard is still here, still helping us out with the structures across from the homeless facility on Worthington Street. And the state police continues to give us backup and help on every shift, as came in handy on Friday night. Friday night, as you know, we had 1 murder and 4 people that were wounded by gunfire. It was a house on College Street. They were having a gathering. The gathering was in relation to somebody else who passed on that date 2 years ago, so they 30 or so gathered at the house. I don't think I'm going out on a limb here by telling you that it was guns, drugs, and gang related. They have weapons that are really unbelievable on the streets of Springfield. That erupted on College Street. They fired at this house party. The house party returned fire. And then a pursuit began from College Maynard Street area onto Page Boulevard, another small gunfight at Page and Berkshire, and it continued on into the Orchard. No one at this time is willingly cooperating with my detectives, Captain Duda and the Springfield Police Department. You have one 22-year-old who is dead from the gunfire. You have 4 others who are injured. And no one is helping us out with this. So we're doing it the slow and old-fashioned way of other witnesses checking video, and that they're working diligently in the homicide unit. We do have some suspects. Again, I don't think I go out on a limb by telling you that these suspects are repeat offenders and are known to us. So we will work that case. It's a fluid investigation. That's where it stands right now. We did recover a high-capacity semi-automatic weapon Friday night. We did recover a large quantity of cash. So that they're still working on that. Other news at the Springfield Police Department, I did bring back 5 officers from an incident in April of 2015. These officers currently have criminal charges pending. They have not been resolved. The trial is kicked back even further, possibly 2021. These officers that I brought back were suspended without pay for about 1 year's time. They have not received any back pay. They are still facing criminal charges. They are still facing departmental charges. They have not, at this time, been found guilty of anything. And bringing them back to work at this time was the thing I felt to do, and I stand by that decision. I thank the mayor for his support on that, and I thank the Law Department, Attorney Percula and Attorney Mahoney for their support on this decision. And I believe it'll work out well for the department. They are also part of the group that was charged later on by the Attorney General's office, and 4 of those officers have had their charges dismissed outright. So that is this group that I'm speaking of. They are being recertified. Today and tomorrow they will join our ranks on Wednesday. Other than that, I think the police department's in good shape. We continue to work diligently. We've seized many weapons the last few weeks. We have made some great arrests. Again, we deal with the release of criminals from jails and prisons because of COVID, and yet the officers are out there dealing with the virus themselves every day, doing a good job. And I'd like to thank them, the women and men of the Springfield Police Department, for their diligence and their work ethic during this time. Thank you. Thank you, Mayor.
Thank you, Commissioner Clapprood. Thank you, Commissioner Clapprood, and to you and your team, Godspeed. Our firefighters, under the command of Fire Commissioner Bernard B.J. Calvi, are out there day in and day out, saving lives, putting down any type of structure fires, you name it, they're out there. And BJ's been very, very proactive in preventative care aspects to make sure he's been able to keep the firefighter number down pertaining to COVID-19 coronavirus. Without further ado, the Springfield Fire Commissioner Bernard B.J. Calvi.
Good morning. Thank you, Mayor. This morning, I'd like to report that we currently have 4 members out on COVID-related illness. Of that 4, we only have 1 positive case at this time within the fire department. The other 3 are on home quarantine due to exposure, off-duty issues. In terms of people infected, people quarantined, for a major metropolitan department, we are very low by comparison to other departments in the state, whether it be Worcester, Boston. They have had a larger number of members infected and out on quarantine. So I think that our actions we took as soon as this emergency was declared are paying the benefits now. We've had increased cleaning apparatus, cleaning the stations. We've had the school superintendents coming through daily, or the school custodians coming through daily with the atomization gun, sterilizing the station, sterilizing apparatus. We've been practicing good social distancing inside the station for training and other type protocols, and we've adjusted our response protocols for medical calls to enable us to better protect our members as we go and answer all these calls. This has been a team effort by everybody in the fire department and everybody in the city. And I'd like to thank the entire fire department, from my command staff down through to the captains, the lieutenants, the firefighters, and the newest probationary firefighters on the fire department. They've been doing an outstanding job during these very stressful and trying times, and I think that it's paying off for both the department and the city and the citizens at this point. That's all I have for a report this week, and again, I'd like to thank Mayor Sarno and all the other cabinet heads, especially Commissioner Claproot. Her and I have been working very closely together as this has unfolded, and everything's been going very well. Thank you very much.
Thank you, Commissioner Calvi. Thank you, Commissioner Calvi. Everybody speaks about the cleaning and proactive disinfecting that's going on, and at the command of that is Patrick Sullivan, who is the Director of Facilities and our Park Superintendent, the Wizard of Oz, I call him, and he's been instrumental, along with Helen, Carlton, Harris, and my Chief Development Officer, Tim Sheehan, in our health tenting, state-of-the-art triage unit there. So without further ado, we'll bring up Pat Sullivan, and he'll give an update on all fronts. Thank you.
Thank you, Mayor. Good morning, everyone. Once again, I want to thank our frontline custodial, park, and forestry employees. They're doing really a remarkable job in keeping our buildings and open space safe. I also want to thank Dan Warwick. We had, at the same time, put an order in for these handheld electrostatic machines, and he got the order before we got ours, and he shared about 6 of them with the facility side. And I thought the residents should know how we're cleaning our buildings. These are very important. They take a tablet that is set up to kill bacteria and viruses, and they're very effective on the COVID virus. So City Hall has one, the police department, the Fenton Center, and then Dan has also worked with us to assign custodial staff to go into the fire stations throughout the city. So I'd like to think these have played an important role in keeping our numbers down and keeping our first responders safe. Over the next week, I will continue to work with Tim Sheehan and Helen Carlton as we manage the triage tents and provide the necessary resources to the Friends of the Homeless. Also, over the next week, we're going to be working with the mayor and Helen Carlton in developing the protocols necessary in the reopening of our city. We are still looking at all the guidelines, but this type of technology will be very important as we roll that out. And we just need everyone's cooperation as we develop those guidelines. And last, I just want to thank the mayor and my fellow cabinet heads. It's been an honor to work with all of you as we navigate the fight of this virus. Thank you.
Thank you, Director Sullivan. Thanks, Pat. Again, as I always say, Springfield's in the business of business. My Chief Development Officer, Tim Sheehan, and his team have done a tremendous job making sure that we're able to cobble together money to get out to our restaurants and now to our small businesses. And again, I believe we're the first out of the block, if not in this Western Mass area, but maybe even in the state. We're going to try to do whatever we can. I can urge the federal government side in their stimulus packages. I know they're in 3 or 4 now. Besides the governmental aid we need, they really need to besides the PPP, the SBA. That really needs to be streamlined a bit more for access for our business community. But Director Sheen will give you an update on where we stand and where we're going. And again, we work toward, hopefully in a short period of time, starting to phase in to get back to some normalcy. But again, it has to be done the right way. Chief Development Officer Tim Sheehan.
Thank you, Mayor. I wish I could say that the economic impact of this virus has leveled off. If anything, it continues to increase at alarming speed. As the mayor said, we're hopeful that Congress will approve another stimulus package coming to the SBA so that they can begin to reopen the PPP program. That has been a lifesaver for so many small businesses. Our programming locally has been intended to ultimately allow small businesses to continue to operate under the emergency orders and to maintain their employee base as best they possibly can. It was always done with the intention that there would be a larger federal package that would be made available to them. As that is slowed down, obviously the need for continued involvement with funding at the local level is a critical need. We have processed all of the restaurant awards have gone to contract. The first round of checks went out this past Friday. We got in over 100 applications, well over 100 applications for the small business round. We have approximately $500,000 available to make awards with. There was the applications that came in totaled $1.5 million. We'll be reviewing and scoring those applications through this week, and hopefully we'll be able to get to an announcement before the end of the week as to the award winners. Thank you, Mayor.
Thank you, Director Sheen. Again, we have nearly $750,000 that is going out there, and work very closely with Chairman Neal, with Ritchie, Congressman Neal, as they continue to put another package together, and with TJ Plant, my CAFO. Some white papers have come up with RGN's revenue generation notes. People are familiar with band anticipation notes. And I think Governor Baker echoed that on Face the Nation this weekend, and I know Governor Cuomo has, and Mayor de Blasio, myself and others, that there needs to be a shot in the arm coming to state and local governments because we're continuing to spend, continuing to do frontline services, and it's important with revenue not coming in, deficit spending, there's only so much in reimbursement that could come in, and we want to continue to be ready to go. So I'm hopeful, whether it's a phase 4 or phase 5, that direct aid could come through, whether through the state, which Springfield receives a fair amount of direct aid, local aid, and school aid, Chapter 70 money, trickling down to the municipalities. This $750,000 is a grant. It is a grant, unlike some of the federal programs, which are loans. And if you don't follow all the criteria, you have to pay back those loans. So we're trying as best we can, a balancing act, to give everybody a shot in the arm that's currently operating. So I appreciate Tim's efforts immensely on that. You know, unsung heroes out there, DPW workers, besides the custodians and others, they're out there day in and day out. They're picking up the trash, they're picking up the yard waste, they're doing the road work, filling potholes, construction, paving is going on, and that's headed by our DPW director, my DPW director, Chris Signoli, who has done a tremendous job. So, you know, when you see DPW out there, give them a little bit of a shout out, beep that horn, give them a thumbs up. Without further ado, Department of Public Works Director, Chris Signoli.
Mayor, thank you. With regards to DPW, we had 2 employees that have been out on quarantine were not positive will be coming back to work tomorrow, so the DPW will be back at full staff. We do have a handful of employees who are out who either themselves or family members have severely compromised medical issues, transplants, heart issues, et cetera, that we are modifying their work hours. With regard to yard waste, our first week, last week, extremely heavy. We are about a half day behind. So people who had yard waste out on Friday, we will be picking it up tomorrow. Construction activities have slowly started to ramp up. Mill Street and the intersection of Mill, Fort Pleasant, Belmont, the big intersection there started today. So you will see a lot of activity out there. Our guys are out there doing everything that they can with regard to yard waste. We usually work 3 or 4 man crews. We're working 2 to keep people apart. So that is one of the reasons why it's taking us a little bit longer. Trash and recycling is on schedule. No issues with that, and we will be moving forward. And the only item that we are not doing now is our sidewalk crews. Building new sidewalks has not started. That's a 3 or 4 or 5 man crew that we're trying to keep apart. So some people who are anticipating some sidewalk replacement work early in the spring, that has been delayed. But basically at that point, that's the only thing that we're behind on DPW today. I really would like to thank my guys. We have had no issues inside the department. They've performed admirably, and everything has been done that has been needed for the city to stay on with what we need to do inside the DPW, even working overnight in the middle of April with snow over this past weekend. So I want to thank them, and definitely want to thank the members of our team here. Everything has gone wonderfully, and it's a very, very good crew to work with. Thank you, Mayor.
Thank you, Director Signoli. I know my CAFO, TJ Plant, is here. I don't know, TJ, if there's anything else you wanted to add? Okay. And my legal eagles are here, City Solicitor Ed Pakula and Human Resources and Labor Director, Attorney Bill Mahoney. I know, gentlemen, if there's anything else you'd like to add? Attorney Mahoney?
On behalf of the city employees, I just want to take a moment to thank the mayor. Through his persistence, he's been able to get us a ton of PPE and these thermometers for our employees now, which is another game changer for us, which is going to help us as we continue our efforts to make sure that we keep a safe workplace for our employees. And again, Mayor, I just want to say thank you for that, and we certainly appreciate what you're doing on our behalf.
Thank you, Bill. You notice Bill has the John Wayne face coverings there, so yippee-yi-yo-ki-yay. We have a little laughs early in the morning in our morning meetings with that. The infrared thermal thermometers, and again, Patrick Leonardo's here from AMR, and I can't say enough on with the homeless triage tenting medical facility we have. But when I made that call, that human cry for PPEs and especially the thermal infrared thermometers, Patrick and AMR came up immediately to get us a handful, and again, I'm very thankful. I keep knocking on that door, and sometimes I have to kick that door in. But MEMA has come across, and we received, I sent it out again this weekend. Ask again, ask again, ask again, which is what we will do with FEMA on reimbursement, as we've done before. And to Samantha Phillips, Sam Phillips, MEMA, and obviously Governor Baker, Lieutenant Governor Polito, and Health and Human Services Secretary Mary Lou Sutters, thank you for getting those infrared thermometers here. They're key because our workforce now will be tested going in and out. I think that's besides, we've been very good about keeping the number down of frontline people being out, police, fire, DPW workers, health workers. And again, Commissioner Clapperwood has stepped up where the courts have been shut down. We're helping DCF out. The sex offenders weren't being called in. We stepped up to call in those sex offenders to keep our public protected. So they come to the department. So now all these, it's key. All these things are key to be used on that. So with that, I deeply appreciate, again, Dr. Mark Kerouac, the President and CEO of Baystate Health Systems, and Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare. Take the time every Monday, and we will continue these press conferences every Monday at 10:15 unless something else should arise in a good way or a challenge from their busy and hectic schedules to be here. So to all the media, which I deeply appreciate you being here because you're getting the message out, whether it's from washing your hands, face coverings while you're out, or staying home while you're sick, and social distancing. Any questions, please, could first go to the medical experts here of Dr. Mark Kerouac and Dr. Robert Roos. Amanda, go ahead.
My question is for obviously both of you guys.
Gentlemen.
Comments made by Dr. Burke over the weekend, saying that Massachusetts is kind of a watch spot for them across the country. And I wanted to ask you guys, especially with your messages of optimism today in the hospital system, where does Massachusetts fall in the context of this new attention from the federal government on Massachusetts?
I believe Massachusetts is the third, is number 3 of the country as far as confirmed cases. And we're up there when it comes to deaths as well. I don't think we're at the highest level. You need to understand that for the confirmed positive cases, there are scores more undetected cases in the community. So I'm not trying to tell you we have more real cases than, let's say, California does. But a couple of things worked against us on this one. We got the disease relatively early from that biotechnology conference in the greater Boston area, so there was early seeding. Here in Western Mass, I believe the first non-travel related community transmission happened out in Berkshire County. So when this virus catches a community unaware, then it's kind of like the Italy situation. The other thing we have going against us is we have a somewhat older population than many states. And so, as you heard Commissioner Carlton Harris say, over half of our deaths have been in elderly individuals. And the disease can really spread like wildfire in nursing homes, and we simply have a somewhat older population. I think those things worked against us, but you know, I think that now things appear to be stabilizing in most areas of the state.
Nothing else to add.
Any other questions for Dr. Kerouac, Dr. Roos?
Is there a sense of why Western Mass seems to be, maybe we just didn't get as much of a spread early on as you suggested, why we seem to be doing a lot better than Eastern Massachusetts is doing, comparatively speaking, still the same state?
Yeah, so I think some of that would speak to what Dr. Kerouac was saying regarding the way in which the virus spreads, and when it enters a community, the density of that population, as well as if there's particular hotspots that might create more of a concern. So there are areas of Western Massachusetts that are perhaps less densely populated. The patterns of traffic and interaction may be a little different than in some other areas like Eastern Massachusetts and inner city Boston, or certainly in areas like New York City. And I would certainly say that it does seem, when we look at the overall capacity that has been created within the hospitals, both here in Western Massachusetts as well as other areas throughout the state, what the Department of Public Health is putting out is that it looks fairly similar, and that there was a tremendous increase in bed capacity that was created to be able to handle a potential surge. And whether you're in Eastern Massachusetts or in Western Massachusetts, we still are somewhere in that 40 to 50% occupied with 50 to 60% remaining capacity. And as Dr. Kerouac had mentioned earlier, that is even considering we have not moved into some areas outside of the hospital walls.
Any other questions for Dr. Kerouac and Dr. Roos? So if not, they can get back to their important duties. Okay, hearing none, gentlemen, thank you very much.
It's our pleasure.
Talking to you, and I'll see you next Monday.
Thank you.
Hopefully with good news. Any other questions of my cabinet heads or myself? Captain Hook.
Yes, in relation to the kind of pump, I've been speaking to a few different businesses that are obviously receiving funding. As far as this week, they received the second round. Is that right?
The first round checks went out Friday. So certain restaurants might be receiving checks, whether over the weekend or they're receiving them possibly today. The second round, I can have Chief Development Officer Tim Sheen speak of, is being done right now. And as soon as that is done, we look to get the contractual stuff done and checks out ASAP. But Tim, maybe you want to, for Doug Hook, please?
Sure. The restaurant round, which was approximately $225,000, there were 30 awardees, and we have advanced the vast majority of those through contracting at this point. The first round of checks, I believe that there were 7 or 8 checks that were released on Friday afternoon. We're anticipating throughout this week, checks will be going out to those 30 restaurants that were awarded. Thursday at close of business, 5 o'clock, was the deadline for the small business round. We've gotten in well over 100 applications. We're scoring those right now, and we're hopeful that we'll be able to announce awards on those by the end of this week.
Just to follow up on that as well, so you mentioned for the second round there were over 100 applications. You couldn't obviously accept or give to all of the businesses that applied because you'd essentially run out of money. Is there going to be another round? Is there going to be a third round for those that maybe missed out of the second round?
We're right now in the process of putting together the action plan for the CDBG CV, which is the coronavirus special award under CDBG. We're anticipating that there will be a healthy allocation of that resource to small business assistance. So that's what we're looking towards that.
And when might that be?
I can't give a time certain on that, but it will be coming forward as soon as we have to do a 5-day public comment period and before we can actually move the approval of that plan to HUD. And after we get HUD approval, then we'll be programming that money. Okay?
Thanks, Doug, we're trying to move as quickly as possible. And again, ours are grants that we're giving out, and we expeditiously, we're hoping the federal government acts as quickly as we're acting here. I only have so much a pot of money, period. You know, under municipal law and under state law, I'm obligated to balance my budget, which we have done every year, and I think the last 4 or 5 years we've done it without using any reserves, which is unheard of at municipal level. The federal government can, you know, quote, print money within reason. So we need that influx to come from the, and this is federal money. They're in the midst of their phase, either 2 or 3. We're hopeful they're going to come back to vote on this as early as Wednesday. And then we have to follow, as I said before, we have to follow CDBG and HUD guidelines because we are audited. And I'm very proud of my administration. We have a great relationship with HUD, and we've never had any issues whatsoever on it. So we'll try to fight for every dime I can get to my small businesses and restaurants. I think this period, Tim, we have about $500,000 out, and there's probably been $1 million of requests, or $750,000 of requests. As with the 225,000 or south of that, there was probably a $500,000, $750,000 of requests. So we'll try to do the best we can. Go ahead, Paul. And I know Audrey had a question. Okay. Audrey, did you have a question on Echo Dev or no? Okay, Doug's going to, then we'll go to, okay.
Yeah, I just wanted to follow up on that. You said you needed more help from the feds. So
yeah.
Elaborate as to what that help would be, is it just financial? And also, just on top of that, what's the plan for the future after we hopefully get through this?
No, we will get through. We will get through.
What's the plan for businesses in the future?
Yeah. Well, here's the thing, as far as on the federal government. Number one, they're putting out there the PPPs or individual assistance, fine. We need relief 2 ways, to the business community, continued relief on that. And again, I thank Chairman Neil Ritchie for his continued efforts. 2, we need a stimulus supplemental or another phase that monies, again, I've said this, Governor Baker has said this, Governor Cuomo, Mayor Blasio out of New York. States and cities are losing a tremendous amount of revenue. I just gave you my figure, and we're maybe a month and a half into this. We are the ones that employ police, fire, DPW worker, teachers, libraries, you name it. So there's going to have to be some difficult decisions being made in a balancing act of keeping city services going. So there needs to be an influx of money there. We've all said it, and it really has to be led by the federal government. Testing, 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 testing. Now, I was being told that I could get these infrared thermal thermometers on the open market. Right? Believe me, I called everybody and their mother to try. Nobody has, and we're willing to pay for it. So I'm very grateful on that. On the, you hear on a federal level, the availability of testing. We're a country of 350 million, 370 million. I mean, if you're testing 10%, that's 30 million. We're testing, I believe, about 1%. Testing, those Abbott machines, those testing kits, those swabs, in a coordinated effort with the contact tracing, which we've already, Springfield has already been doing, and Governor Baker has taken a lead in the nation on that. Because the last thing is we will, there'll be a phasing in of an opening, a reopening. Maybe it'll be a new normalcy, but it's got to be done correctly. How do you do that? And you heard it from Dr. Kerouac and Dr. Roos. More testing goes on. The numbers potentially are going to escalate. But with that testing, you're able to, and Helen's been great, Jason, we wanted to identify areas, the hotspot areas that we have, so we could be target testing, proactive. Now, not everybody in the nation is going to get tested. Not everybody in the state is going to get tested. Not everybody in the city of Springfield is going to get tested. But if we're able to target test, and we can hit those hot spots, and we'll be proactive, now we're able to identify. We're able to isolate. We're able to do the community mitigation, the contact tracing. That's what builds confidence. Public confidence, business confidence, consumer confidence, and just as importantly, I give everybody credit, we worked hard to make sure if there's a little uptick or a surge, our hospitals can handle it. They have the capacity. In my conversations with the state government and federal officials on the Mass Mutual Center with Dr. Kerouac, Dr. Roos, we're okay. We might need some other things said in our way, but we can handle because of the things we've done. We'd rather not take something on and take it away from somebody else here in the Commonwealth. The last thing, and Governor Baker with Governor Cuomo and a number of other governors, I think it's 6 or 7 or 8 coalition in the Northeast area, are working together in concert. I will be looking to do the same thing with other cities and towns in the western Massachusetts area, maybe even northern Connecticut, because people move in and out. So we all have to be on the same page when you reopen. And also, businesses, there's opportunities here. There's an evolution that's going to occur. Businesses are going to change the way they do business. You're also going to find that a lot of work has been done remotely. It's going to be relooked at the private sector. I'm going to relook at it in the public sector here. I'm proud to say, and there's other private sectors obviously have faced layoffs have occurred. Other municipalities, layoffs have occurred. I'm proud to say I've kept my workforce going. And that's my intent within reason. But adjustments, if money doesn't come in and we're not able to generate money, adjustments will have to come by, and we're working night and day to avert that. So that's where we're at right now. You don't want to get to the point where you say, here's a line, it's time to cross that line. You didn't do all the proper procedures? Yeah, we crossed that line. 2 days, 2 weeks, 2 months later, a surge occurs. That's double even worse when it comes to public confidence, business confidence, consumer confidence, hospital confidence. So believe you me, I'd like to open up tomorrow. But tell that to the people who have lost loved ones or the people suffering it now. Tell that to the hospital workers. So this has got to be really timed out, and it's got to be coordinated. So the more testing needs to be done, and then you identify these areas. Okay, so we know we have in urban centers across America, there's high density, you know, with apartment complexes. We have a lot of senior long-term care areas. Again, Helen's been on the forefront with that, with DPH, and now the med techs from National Guard are there. We can zero right in there. Zero right in, work with our hospitals and our community health centers, work with our partners, the groups that are getting money through this CARES Act that deal with non-traditional residents of the city of Springfield. Maybe if they knock on that door, they make that phone call saying, in their language and culture, saying, we need your help here, then we can identify. So now you show confidence that once we start to gradually open up, we've already identified a hotspot area. We've isolated now. We've gone in, contact trace, community mitigation. We knocked it out. Now people say, okay. So you might, as things start to open up again, you might see the face coverings late afternoon, early evening. My wife Carlton, my daughters Cassandra and Kiara, we took a walk around our neighborhood, the coverings, and I see people wearing the coverings. So when you're out and about on that. But these little things mean a lot. So that's the phased-in approach. But I just have to echo, it's a balancing act. You can't jump too quick. If you jump too quick, you're going to be set back tenfold. So the more help that can come on the federal and state level, I'll do whatever we can on the local level. I want to get people back to work. But you want to get people back, and it's got to be based on health, medical, and science. Factual stuff. And then we'll use the formula for economic development. Audrey? Again, my cabinet heads are here too.
Yeah, I have a question for Superintendent Warwick.
Sure. Danny, Superintendent Ward?
Hi.
You had mentioned earlier that you guys were waiting for some guidance, I think, from the governor as to reopening. I know as of right now, it's May 4th, and that you guys are preparing for May 4th reopening, but they were also expecting some guidance, maybe extending that. And I was wondering if you had a more concrete timeline as to when we might hear more about that.
I think we're going to hear from the commissioner and the governor within the next week about a possible extension on that.
And, are you guys planning on the off chance that they do keep the May 4th opening date, or are you guys pretty much planning that it will be extended?
We're planning for both because we don't make the decision. So, but we expect it to go on.
While you're up there, Governor Baker said Friday that it was his belief that most school superintendents around the state would prefer to go back, if only for a couple of weeks, so that they could do things like efficiency tests, just to see, where things stand, and maybe plan some remedial work if we go in the summer. I mean, do you agree with that assessment? Would you prefer to go back, even if it's just for a very short period of time, just a couple of weeks?
I would. I'd prefer to get back in because I think the kids and the families need it. But we'll have to make sure everyone is safe first. Every time we make one of these decisions, you have to make it around safety first. But it would be great if we could get back in. If we can't get back in, we're planning a really robust summer program because the kids are missing a lot. My staff has worked very hard on a remote learning plan, but it's not the same as being with your teacher every day, and the kids are missing a third of their school year if we can't get back in. So we're taking that very seriously.
On the subject of the remote learning, there's been some anecdotal reports from different places around the country that while, remote learning, people really were engaged in it at first. Now the participation levels have kind of fallen off. I guess in Los Angeles, they actually kind of take attendance at the beginning of the day, whatever, and it's fallen now to the point where only 40% of their students are participating. Do you have any way to measure what the participation level is in Springfield as far as the remote learning goes?
Yeah, we're looking at the technology to try to start to measure it. In Springfield, I believe it's still increasing because we just finished our distribution, and then we're going to continue to distribute laptops to other families. What we're also doing as we track is to find families that haven't engaged yet. Again, having staff, counseling staff, administrative staff, teachers, reach out to those families and try to really get them engaged in this process. But it's probably around that 40% in Springfield right now, but we expect it to go up, and we're going to continue to work at it.
Any other questions? Audrey, go ahead.
I have a question for Commissioner Clapper.
Sure. Just let me say, Cheryl, Paul, to you, we're one of the few urban districts in Massachusetts and maybe in country that we invested a few years ago. We made the adjusted money, made cuts to make sure that laptop computers would go out to our kids, which 7,000 were already out. Tell me another district that's been able to distribute 10,000, 17,000. I mean, there's some that are larger than us that have not made that capability. So kudos goes out to Superintendent Warwick, a school committee, and our administration and budgets that we made that, not for this reason though, but we made that investment. Commissioner Clapper?
I just wanted to ask about social distancing and enforcement. Should we announce that there are going to be issuing fines and violations for folks who are caught not social distancing? Is the Springfield Police Department going to be enforcing outside of the putting green circle situation any kind of social distancing violation or issuing any kind of fine?
We're guided by the mayor's decision, and I certainly do advise him. And at this time, I have reported to him and to the other cabinet heads that we have received calls for house parties, for gatherings, and when we respond, the officers get on the PA, and so far, people have been abiding by our warnings. So far, we are A-OK. And of course, we're focused on the people who don't care about life and death certainly don't care about social distancing. So our efforts are focused to end this crime problem, to make people feel safe again. But I will say thank you to the community. Everybody has just heeded the warnings. Thank you.
Audrey, just to let you know on that, about communicating. I mean, Cheryl and I have enough trouble keeping bad people off the streets with our courts. Can you imagine handing somebody a ticket on that? So we've been trying to communicate, and it's been working. Now there's some areas pop up, we get a phone call, we work, whether it's business and or if health has to become involved, or building code, or police, about relationships. But we have enough trouble trying to keep people who should be locked up, that our courts let go, and you want me to be handing out a ticket, which you know what they're going to do with the ticket? You know, just like this. Just like that. So ask nicely. They've been pretty abiding. They get out of hand or do something that they shouldn't be done, then law and order goes in effect for their good. But it's been working so far. I'm not saying it's perfect, but to put something else on the books when we're arresting people who are committing literally capital offenses and they're letting them out, this is a better way to do it.
Commissioner, obviously there was this very serious incident Friday night, but I'm wondering if over the course of the last month since this pandemic started, what have the calls for service been like? Have they been more or less about the same? And,
Yeah,
what types of calls are you dealing with primarily?
I tell you, Paul, the first couple weeks of this pandemic, the calls for service went down. People were, adhering to the stay home, stay in. Now, lately, as of the last week, I will tell you, I think everything has been an uptick, and that can be attributed to a couple things. First of all, the release of prisoners and inmates. Secondly, the closure of the courts making things difficult. And thirdly, people are naturally just getting impatient with the way things are. So they're coming out a little bit. The spike that I thought I would see in domestic violence, we didn't see right away. We certainly are seeing it now. Friday morning, instead of having 15 to 20 restraining orders we daily serve, we had 40. So you're seeing the problems with domestic violence. You're obviously going to see the problems with the gang and the drug violence because they simply don't care about the quarantining or the social distancing. The amount of money we seized Friday night tells me that it's a lucrative, illegal opportunity that they're still going to take advantage of. So, and of course, the nicer weather's starting to come upon us. So with those issues, yes, the crime rate has started to tick up, but we are ready for it, and we'll deal with it. Yes, sir?
Just a follow-up on that. You mentioned the released prisoners and a possible relation between this uptick and those prisoners.
Sure.
Is there evidence to support the fact that some of these prisoners that have recently been released are involved in this uptick of crime?
I don't know about Friday night, Doug, because right now they're still suspects and it's fluid. So, but you'll hear from, I'm sure, the mayor, and you'll hear from me if any of these were recently released. Then it's, you know, there is evidence that there are some that were being held in regards to some of the street level dealings that are now back out. So that's perhaps the uptick in some of my areas where we see the drug trafficking. Yes.
You got to remember, too, that mental health calls have gone up. Commissioner Clapper has moved to BN. We work with the Behavioral Health Network, BHN, and she's increased that partnership moving forward. You will see that, again, that these individuals are known to the police department. See all my people? They're working. My DPW, they're out there working. Healthcare's out there working. And building inspectors, codes, they're out there working. Back office stuff's out there working. Why aren't the courts working? I mean, there's ways you can do it, with all due respect. Don't you think, which we wouldn't, because our duty and our responsibility is to provide for the residents and business community of the city of Springfield. We're out here every day, every night. Besides, that's our job. We have families too. But I don't understand certain institutions that are not open, that play a pivotal role. There are ways you can open. There are ways you can deal to aid my brave and dedicated men and women in blue in the police department in judicial process. We've dealt with it here. How we deal with situations if anybody becomes affected with COVID-19 or coronavirus. So, we're all out there. The grocery store, everybody's out there. They're all working. Your mail's getting delivered, okay? You can do it remotely. You can bring a certain number of people in. You could run important things that need to be run through the court system. I know they are doing some, but we got to get down to the next level now. Because what happens on the next level is these guys who have no respect for life whatsoever decide that they want to start shooting people. You're going to see that these are known people that for whatever reason the courts in the revolving door they have says, go right ahead. Go right out there. I don't like that. And that's not what my residents nor my business community wants when I'm out about in the neighborhood. I don't care what creed, color, or background. It doesn't matter to me. If you're a bad individual, you're a bad individual. So she can't say as much as I'd like to say or she'd like to say on it. But the police are out there. They were instantaneously, I got the call. Shots, they were there in seconds. That's why they were able to grab people, grab weapons, grab a big amount of cash, too. But nobody wants to talk. Nobody wants to talk. They'd rather gather, God forbid, somebody's hurt or killed to memorialize he or she, when they could be saving lives, gathering in times of celebrating, not in times of sorrow. And I say to them when it's, what if it was your family member? What if it was your close friend? Why would you protect these individuals? But then again, sometimes it falls back to the court saying, Jesus, Commissioner Clapperud, Mayor Sarno, hey, I worked, and that person's, the person's right back out there on the street. The community policing that we're doing, the C3 policing. So people unfortunately have no respect for life. The majority of the people, city of Springfield, all beautiful mosaic we have, are great, great people. But it's that 1 or 2%, the same ones that repeat the crimes. And they have to, I'm all for rehab, rehabilitation, I'm all for proactive program done in schools, youth development, but you get that 1 or 2%, the only thing they understand, because they have no respect for life, is that you have to be forceful in your punishment and judicial process, and you need to be quick about it. Because it's difficult when you have to deal with a family of a victim or a victim saying, why is that person out on the street? So I'd like to, we're all working here. We're all working here at City Hall. Matter of fact, today we're working. Today technically is a holiday. We're working. We're in the middle of a pandemic. Everything against the wall now. Extraordinary times. And I'm damn proud of my cabinet heads and my rank and file. Tested and true. Tested and true. We know we can't make everybody happy. But we'll get through this. We're going to get through this. Keep doing what we're doing. We'll get through it together as one and for the better. Let me stop from there to take questions from my cabinet heads.
Mr. Mayor, a quick follow-up on that. You've been not shy at all about contacting the courts and so forth about some of these issues before. Have you contacted any of the chief administrative officials in the court system or asked DA Ballooney to contact them if,
I shouldn't have to, Mr. Safransky. We're in the business, public safety business, shouldn't have to. There's a way, we're open. There's a way. We're doing, some things are getting done. We need more things to get done. There's a way to do that. State government, there's a way. Facilitate it and get it done. No disrespect. All I know is that we're on the street. I'm reachable, and it's fine with me. So isn't the commissioner. So I don't have any direct control over that. I'm just saying that here, we're working every day.
But wouldn't that street level contact to them perhaps offer some of that perspective? I mean, if people make these decisions aren't in Springfield, so, has there been that kind of conversation with the court system to try to have a little bit more activity to solve some of these?
I think some of the court system across the state has I think they vilified me enough so they know where I stand on the situation on it. I put out there, I mean, here's a point, two things, okay? Sex offenders. Who's doing it? Springfield Police Department's doing it. Court shut down. I need to tell them that. Department of Children and Families. That's state, am I correct? Who was doing it? Springfield Police Department was doing it. I need to tell them what to do. So,
conversations with Governor Baker either?
What's that?
Does it come up in conversations with Governor Baker?
I have a lot of conversation with Governor Baker on it, on different situations that arise. My point is that that is a serious division of state government. Would you like if I stood here and said, well, you know what, we can't open up. We can't do anything. Police aren't going to go out. Fire aren't going to go out. Your trash is not going to get picked up. But nothing's going to get processed. We're stepping aside. Now, we've adjusted and made rearrangements, but that's the business we're in. Public service for the residents and business community. So, media's here. I'm sure they'll hear my message again. I'm sure they'll hear the message from you, whatever slant you're going to put on it. But we appreciate it.
I got a question for Helen.
Sure. I worry about my house. Other people need to worry about their house. They want me to run it, I'll be more than happy to run it.
Yes, sir.
Commissioner, have you noticed, do you believe that there's a regional disparity in the availability of testing in Massachusetts? I mean, I know, as the mayor alluded to earlier, Boston has done testing of their homeless population, Worcester's done testing of their homeless population. You couldn't get test kits until last week. You had to ask Congressman Neal for help, and now you're just going to begin to do the testing on Wednesday. So is there a regional disparity?
I believe there is a regional disparity. The fact that we had to reach out to Congressman Neal in order to get the testing that we needed would simply tell you that we weren't able to make a telephone call and get what we needed. However, we have a congressman who cares deeply about the city of Springfield and our vulnerable populations.
Mayor, has the subject of testing come up in your conversations? You had a conversation this morning with the Lieutenant Governor. Is that issue come up?
It certainly did over the weekend. I told you through my Chief of Staff, Tommy Ash. I said, send it again. Tell Bobby Hassett, my emergency preparedness officer, send my request again. I'll send it every day. Now, I thank them. Those the thermal infrared thermometers did come in. You know, we were denied first time off the bat. The testing, and I only wanted to do the same thing that Mayor Walsh, Marty was doing in Boston, and what was being done in Worcester, because when they did it in Boston, they saw those homeless testing positive shoot up tremendously. And we wanted to be proactive with Helen. We talk all the time. Target testing, target testing. So we asked for it. And again, I'm very appreciative of Chairman Neal, Congressman Neal Ritchie. And again, to MEMA, you know, we eventually got it, Sam Phillips. And I have a great relationship, a great friendship with Governor Baker and Lieutenant Governor Polito. So I think slowly but surely we're getting what I want more. I know the state sometimes got into a jam when the federal authorities were usurping supplies that were coming in. I know in the Jersey dock that happened in New Jersey. And I got to give Dr. Ehrenstein a lot of credit. He's a military, he's like you, Doc, he's a military veteran. They had to be clandestine to make sure he got those PPEs to Baystate health system because the feds were going to grab them. So what good is it? We have all the supplies we need. Well, if I can't get my hands on the supplies, what good is it going to do me and the residents of business community of the city of Springfield? So, you know, things are starting to flow now. Again, we need a bigger number of testing kits. And I've said it before on the federal level, and again, I try to be respectful of the offices. That National Defense Act should have been implemented a month and a half ago, if not earlier. I know the comments are made, well, it took a little while and we threatened them, they finally did. You shouldn't have to do that. And the other thing, I think some changes you're going to see probably on the federal level is that made in America, baby. Made in America. That means our business community, too. We're dependent on so many, on trade, I get it, but you're dependent on so many other countries now. You know, the countries have that, they had that spigot. We can't get it to you. We can't do it. Make it on our own. Now, would that cost a little bit more money? Yes, it might. But we control our own supply train. So that's one thing maybe on a national level that's got to be looked at. There's no more better ingenuity than here in the United States of America. But you can see how that affects, how it affects Springfield. I couldn't get the thermal infrared thermometers. Now finally we've had them. Just go on the open market. Couldn't buy them anywhere. We couldn't get the PPEs. I couldn't get the N95 or KN95 masks. Everywhere. We still have orders. I put our money where our mouth. I put our money on the table to buy these things. Thank God. Thank God. When I made that clarion call, the business community and private sector stepped up big, big time. And you know what that cost me in the city of Springfield? Zero. But in my heart, my head, heart, and gut, it's worth millions and millions of dollars what they did. So I just think the more testing, again, will build the confidence, public confidence, business confidence, consumer confidence. Again, working hand in hand with our hospitals, because when you test more, numbers are prohibitively going to go up a bit. But if we can show, spot there, we know we identified it, we isolated it, we're contact tracing it, we're doing community mitigation, and just as important, we're healing that hotspot, we're healing those individuals. We're on top of it, and you move forward. That's key to this this whole thing. And every other citizen in Springfield, the state, or in the country is a warrior out there. They're doing their part by washing their hands, wearing face coverings if you're out and about in public in certain areas, social distancing. If you don't feel well, staying home. So that has helped. That has helped. So we're learning, I learned from what goes on in the country. I learn what goes on in the world. I learn what goes on in the state. I learn from what goes on here, and then we put that in our we'll put that in our equation. So the relationship has been good. I just think certain other entities of government, in some way, they have to evolve a little bit more. Springfield, the city, we continue to work. We continue to work. Any other questions for my cabinet heads?
Question for Helen.
Sure.
As we're seeing some of the cases rise with the hospital administrators, before we are seeing some decline in hospitalization, do we have any sense of how symptomatic or how sick some of these new people are? Do we have a sense that they've been infected for weeks and this is just now when they've been able to be tested? Because obviously the degree of their disease will impact the broader public health response overall.
So what we're seeing is that community spread is pervasive. We're seeing a lot of community spread based on what you're seeing as far as the dots on the map are concerned. And so the question becomes, do these individuals get sick and require some sort of hospitalization? And we don't know that factually right now. What I'm saying is that the numbers in the city, based on what we're receiving through our infectious disease portal, continues to rise. And so the flattening that they're seeing as far as hospitalizations are concerned is not what we're seeing as far as the cases that we're tracking are concerned. The only thing that we don't know is when or if some of those individuals will become sick enough to be able to be hospitalized. But I heard from both hospital systems that they feel they have the capacity to be able to treat those individuals who arrive at their hospitals.
So at this point, this is primarily just data, like I think it's the Maven system that,
yes,
that you have, that you're getting, and you don't have any specific insight into the degree of sickness that any individual person who's testing positive is, correct?
Correct. So next week, what I'll show you is the number of places that we've seen the virus spread and at what rate in what intervals. And so we know that this is really incremental as far as the numbers are concerned. That's why we report them every week. I have no idea how sick those individuals are. When we do our contact tracing, that's part of what we ask. What symptoms are you experiencing? What symptoms potentially may be something that you're concerned about? We tell everyone, if you're having symptoms, if they get worse, to call your primary care physician to get instructions. And what we know is some individuals are having lots, 1, 2, or 3 symptoms. Some individuals are having very light symptoms. And so everyone, many people experience this virus differently. Some require hospitalization or treatment. Others are quarantined for the 14 days and need to stay at home and are working their way through. But at this point, I cannot tell you how many or where they are in their illness. We started this tracking on March 12th, I believe. And so some individuals that we tracked then should be coming out. And you heard our first responders say that there are individuals who are coming back to work. And so that means they have gone through the regimen of the 14 days and are now are asymptomatic and coming back to work. The challenge is many of the individuals in our environment are asymptomatic, and that's why testing is critical.
Can you also just speak to how successful contact tracing has been? I know there's been some problem. And you mentioned it yourself, too, like people concerned about, too much being their business, and there's been some concern statewide that people can spam. What has your department's experience been with people's cooperation overall? Overall,
we've had excellent cooperation. However, again, I think that individuals are very private and they feel guilty. They feel as though they have inflicted something on a virus on another person. So that's that feeling of guilt that we have to have individuals understand that this virus is no one's fault. For the most part, we're getting good cooperation. But I think that there is some reluctancy to give those contacts to us and their identifying information. And that's why it's important to say our job is really to stop the spread. And we can do that when the individuals who are a source or are COVID positive cooperate and give us the information on themselves, what they are feeling as far as the infection is concerned, and then to tell us who they have been in contact with so that we can reach out to those individuals as well.
Thank you. I don't know if there's any other questions. Matt, just as a follow-up to Commissioner Clapper and I do speak with First Justice John Payne, who's always very helpful. And Commissioner Clapper did have subsequent conversations with DCF officials, making them aware of what was not going on that. Any other questions or comments? And I deeply appreciate everybody here from the media being here, to Doug Hook from Mass Live and Republican, and 22 and 40 Focus, Springfield, Paul Tuthill, Matt Safranci, because it's important. We need to get this information out. And I know at times, especially myself, might get a little bit emotional because we care and we want everybody to be okay. And sometimes we're going to have to be a little bit forceful to get that message across. But we will, as I've said before, we will get through this together as one and for the better, and we're going to learn from it. And we'll come back stronger. But this is a partnership. And I need each and every one of you to continue to work with us. Is it going to be easy every day? No. But there's going to be another day. It seems that what we're doing is working, but we have to continue that momentum. So when we start to phase back into normalcy, we just want to make sure it's done the right way, so you don't face any type of demoralizing setback moving forward. I will continue to give you updates on, we have our Billy Baker, my communications director, does a great job on our social media and our web pages. Matter of fact, those are in, I believe, 96 different languages that they're translated to, by the way. And we'll continue. I know Helen has done a robocall. I've done a couple of robocalls too, and also to our Latino and Latina culture. We've done that through Helen. Gladys Oyola, my election commissioner, did a great job representing me on a social media requests information out to our Latino and Latina community. So we're going to continue to work day and night to get us through this. And again, a big thank you to my cabinet heads and rank and file who've just done a tremendous job. And like every one of us, they have to go home to families too and take certain precautions. But we're doing this for you, doing it for ourselves, and we'll get through it. If there's nothing else, I wish everybody a good day and stay healthy. Thank you very much.